In this session, we'll be taking a look at HealthShare's Clinical Viewer, which gives clinicians the ability to access patient data which is stored in the Alabama One Health Record Exchange. Let's start by searching for a patient. You can enter in as much or as little information as you know about the patient, but there has to be at least one piece of information entered before you hit the search button. Notice that if I click on the search button without entering any search criteria, I get no matches found. If you know the patient's medical record number, that's the best way to be sure you're calling up the correct patient. If you do a search based on MRN, you must also specify a facility in the Assigned By drop-down box because every facility uses its own MRNs. The list contains an entry for every facility that participates in the exchange. If you don't know the patient's MRN, name is usually the next best thing to try, ideally in combination with some other demographic data, such as date of birth, gender, or address. If you enter a date of birth, it has to be in the format shown on the screen, year-month-day. So for instance, August 1st, 2015 would be entered like this. If you'd rather point and click than type in the date, you'll notice there's a handy calendar widget, so you can go ahead and do that instead. If you happen to know the patient's driver's license number, you can try searching for that. But in addition to the driver's license number, you need to say what the identifier type is. Notice that there are a couple of other choices of identifier type. You can limit the search domain by specifying either a program or a facility or both. A program is like a cohort group, for instance, all patients with diabetes or all patients who see a particular doctor. Programs are defined differently at each healthcare exchange, so when you log in, you can see if any programs are available to choose from. So far, there are none defined here. The facility list will contain an entry for every facility that has contributed patient data to the exchange. So for instance, if you're searching for last name Smith, you might narrow down the results further by saying you want only the Smiths who have seen a doctor at Lake Martin. The data retrieval filter is a way to control what clinical data will appear on the screen and in reports after you pull up a patient. By default, the clinical viewer will display all types of data as long as nothing is being blocked by the exchange's consent rules. If you don't want to see all types of data, start by clicking the Edit link to create a filter. Let's say you want to create a report on a specific patient, but you don't want medications to appear on the report. You can change the information type to medications and change the show column to say no. To save your choices, you need to click the Save and Close button at the bottom of the screen. If you don't see it, you can use your scroll bar to drop down. You may also need to pull the lower right-hand corner of the screen to enlarge it a bit. It's very important to remember that if you create a data retrieval filter, you still have to check the Apply Data Retrieval Filters checkbox to turn on the filter, or else the clinical viewer will ignore it. This enables you to create a complex set of filters once, but then easily turn them on and off as needed. Notice this handy shortcut for calling up a patient you've looked at recently. If you click on the drop-down next to Recent, you'll see an alphabetical listing of the most recent patients you've retrieved with hyperlinks, so you can get to them without having to search again. Now let's search for a patient named Test. I'll just enter his last name into the last name box and click on the search button, and that brings us to the search results page. If the blue search panel on the left goes away, all you have to do is move your mouse over to the left, over to that greater than sign, and it will pop back. Let's take a look at the search results. There's one line for each patient who might match your request, and over in the last column is a ranking score that tells me how closely this patient matches the information I provided. The results will be sorted so that the most likely match is on top. If you click the plus sign to the left of each row, you'll see an entry from each facility that provided data for this patient. The name, which appears in blue, is a link which leads you to the patient data screen. Alternately, you can click on one or more of the lines below the main line for each patient if you only want to see data that was provided by that specific facility. If you click on the top line for any patient, you'll get an aggregated view of all data we have on file for that patient from all participating facilities. The screen we're looking at now is the patient summary screen. Let's take a quick look around the screen to get familiar with the layout. Along the top is the main navigation menu. HealthShare Management Home takes us to the main HealthShare menu. Patient Search takes us back to the search page we were just looking at. View Summary is where you go to view or print nicely formatted summaries of the patient's data. My Account is where you go to change your password and adjust other account preferences for the clinical viewer. Logout, of course, logs you out of HealthShare, but if you don't log out, your session will end automatically after a certain period of inactivity. Just below this line is a line that shows a few pieces of demographic data for this patient: name, gender, date of birth, and current age. On the far right of this line is a collection of shortcut icons, which varies by patient depending on which ones are applicable, but they'll all have this one with the magnifying glass, which is a shortcut to the full demographic information. Notice that when I click on it, I get a pop-up window with the patient's full name, contact information, and various other details like social security number, driver's license number, marital status, and religion if known. The next thing below the demographic data is the timeline, which shows the length of time for which we have clinical information for this patient. In some cases, you'll see horizontal lines above the timeline that represent each encounter, and you can click on those bars to hide or display the clinical data for that specific encounter. This patient doesn't happen to have any encounters on file. To the left of the timeline is a down arrow that enables you to hide the timeline altogether. This can be useful if the patient has many encounters and they take up too much space on top of the screen. To the right of the timeline are links that enable you to select or deselect all of the encounters, so you can individually turn one or more on. You can click the Preferences link to change your settings about the timeline, such as the starting and ending date and time. On the left side of the screen is a menu that shows the different types of information we store for patients at the exchange. The vertical blue bars indicate what type of data we actually have on file for this patient. You can see that our test patient only has documents on file. I can click on some of these other items, but I'll only see empty screens. You'll notice that some screens have these blue icons with 3 dots, which tell you there's more information to be seen. If you click on those, you'll typically come to another screen that shows another level of detail. Now let's take a look at how we can view or print summaries of patient data. I'll click on the View Summary link in the top menu, and the first screen I land on is the default Patient Summary screen. It shows all the same information you are able to see in all of the different data type screens. There's another choice we can make. By default, we get a short, high-level overview of the data, but we can switch to the Classic view, which includes a new header and lays out the same information a bit differently, or we can choose the Expanded view, which includes more information such as any patient-clinician relationships that have been defined in the exchange or advanced directives that may be on file. If you'd like to print a report for the patient, the best format is Patient Summary PDF. You'll still have the same 3 format options to get a summary or detailed report or something in the middle. The PDF can be printed or downloaded to your computer using normal browser features. We can return to the patient summary by clicking the Back to Viewer link in the upper left-hand corner. That concludes our overview of the clinical viewer for Alabama One Health Record.